right, y'all. Good evening. Good evening. It is yours truly, Dr. Barry Pierre. First of all, if you catch this on the replay, please let me know what you feel about that intro video, because I'm probably going to do my own little personalized intro video, but I just wanted to kind of see what a teaser would look like. If this is your first time catching it, I am yours truly, Dr. Barry Pierre, your favorite board certified internist, host of The Real Physician Reacts. This is your first time catching my live stream. This is where I come on once a week live to kind of discuss things that kind of come across my timeline, that kind of hit my DMs, that kind of hit my inbox, and really kind of give you the point of view from the physician. Now, we have kind of touched on this topic a little bit before, probably about a month or so ago. Today, we're going to be talking about another mass shooting that occurred here in this country. We're going to talk about this growing epidemic, which is gun violence. I know a lot of you have heard the term, especially when referencing COVID-19 and now monkeypox, when you hear this pandemic terms and you hear these terms, but we really have, especially here in this country, we have to think about what has been really a growing problem and really is only a problem here in this country. And I'm going to use the word epidemic a lot here, right? So just for a quick definition's sake, an epidemic is a disease, right? Or an issue that is primarily focused on a specific location or population. So when we talk about gun violence, I'm not going to be talking about gun violence in Canada. I'm not going to be talking about gun violence in Africa. I'm not going to be talking about gun violence in the United Kingdom. No, I'm going to be talking about gun violence because it is primarily a United States problem for all of the wrong reasons. But I would definitely be remiss from starting this conversation without really, again, just kind of giving a moment of silence and bowing our heads to another set of victims who are initial casualties of what occurred at Highland Park in the state of Illinois on July 4th, earlier this week, where a gunman who got a gun, an assault rifle, who attempted to disguise themselves dressing as a woman, fired onto a public crowd at this park, and at least what we know ended up killing at least 7 people, right? And I say at least because obviously there's still victims who are dealing with the wounds, and again, doctors and nurses are taking care of them as we speak, right? So I want to first kind of give a spotlight for the victims of those who were affected by this tragedy. Let's share our screen for a little bit. Make sure I got the right page. Yep. All right, I want to make sure we're sharing here. I want to make myself a little bit smaller. Yeah, perfect. So again, I want to take my time out just to kind of remember the victims here. The first of 7 at this moment, and unfortunately, this was, and just so you guys probably can't see that, this was a quote from one of the victims' family. "I knew she was dead," Cassie Golden said. "I just told her that I loved her, but I couldn't stop because he was still shooting everyone next to me. So I just kept running and hid behind a trash can." So before we kind of again highlight our victims here, I want us to think about that, because just like when I talk about COVID-19 and the deaths related to COVID-19, what happens and what people tend to focus on is the end result, which in this case are the deaths. But we need to focus on everyone who didn't die from this recent mass shooting, but are going to be affected for the rest of their lives. Imagine telling a friend, a family member, like, "I love you," but not even having time to process that because gunfire is still coming your way. and you have to hide because, again, you still have to think about yourself, even though you just saw your loved one be tragically murdered, right? So I just wanted, again, just highlight that, this sadness that occurred when I saw that first quote. But just to kind of, I want to kind of give a spotlight for the victim, so we recognize why we do this. Which, again, unfortunately, we keep having to do this conversation. We keep having this conversation in this country. And one thing I will tell you is that as a physician, right? Again, I promise I'm going to get to it. One thing I will tell you as a physician, I'm not going to tire having this conversation, because I think a lot of times, especially, dealing with this pandemic that we're in now, there was this fear and concern, especially from my healthcare providers and educators across, my social media landscape, that we were going to have this fatigue of tiring of discussing COVID-19 and the ill effects of COVID-19 and the deaths associated with COVID-19 and the benefits of a vaccine. Like, we were thinking, like, man, after 2 years, are we tired of hearing it? And fortunately, especially for a lot of the creators that I follow, that has not been the case. We are talking about it as much as we did, as much as we are now, as we were talking about it right when the pandemic started. And I can assure you that this conversation, especially from our physician standpoint, and healthcare providers and public health educators, we are going to do the same with this gun violence. Like, we are never going to get tired of having this discussion. We are never going to feel that having the discussion is mundane. We are never going to feel that, like, like I've already said this before, what more can I say? Like, if I have to do one of these series every other week because something happens every other week, I will do that, because I want people to understand that, like, I'm not going to let up off the gas pedal and screaming from the rooftop that this is a concern, this is an issue, this is a problem that, again, only affects us here in the United States. This is not a worldwide problem, which is why you'll never hear gun violence, the pandemic. It's always going to be the epidemic, right? This is something that only occurs in this growing location here in the United States. It's not going to spread. No, I'm not concerned that gun violence is going to spread to a different country. No, it's going to stay right here in this country for lots of different reasons, which we can have discussions on. It's going to stay right here. And we, as physicians, healthcare providers, public health officials, we have to keep screaming from the rooftops why this is a problem, right? But again, let me go again. Let me give the credence that we need to do. So our first of many unfortunate victims, Catherine Goldstein, 64-year-old, was at the parade with her daughter, Cassie Goldstein. So she was the mother of the quote I read initially, where I said that up here, I knew she was dead. I just told her that I loved her, but I couldn't stop. This was the mother of that victim. Next one is a husband and wife, Kevin and Arena Mccarthy. You can see their ages, 37 and 35. Kevin actually died protecting his 2-year-old son, while his wife died next to him. And what was crazy, this quote really hurt me, right? The 2-year-old asked, when the 2-year-old happened to be found at the police station, are mommy and daddy coming soon? At 2 years old, they're never going to be able to process it. This is something that they are going to have to live with for the rest of their lives. Again, remember, when we talk about victims, we're not just talking about the victims that are directly affected, but everyone who's in proximity of it. Stephen Strauss, 88-year-old, looks like he was a financial advisor. The family knows the family patriarch of the family. Jacqueline Sunheim, I apologize if I'm pronouncing it incorrectly, 63-year-old, former preschool teacher. Nicholas Toledo Zaragoza, 88-year-old man, who again was at the parade only because his family did not want to leave him home alone. Like, I want us to think about that statement. The only reason why he was at the parade that day is because his family said, you know what, we think it's safer for you to be with us than it is to be alone by yourself. Imagine if you are the family member who made that decision, that said, you know what, I think it's going to be safer if you come with us, Grandpa. Like, like just come to the park with us. It's much more safer than you being at home. There's a lot of dangerous things at home. Like this was a decision that that family made, and this is a decision that that family is going to have to deal with for the rest of their lives. Eduardo Uvaldo, again, 69-year-old man. He was taken to the hospital with his injuries. He later died. He was ready to celebrate his birthday, which would have been tomorrow. Right. So again, this so we can stop that. Right. Just again, I wanted to kind of highlight the victims here, just so they get their just due. Right. Because when we talk about this gun violence, again, I had this conversation about that shooting that occurred. I believe it was in Tennessee. We've had this conversation about the shooting in Texas. We've had a conversation about the shooting. Like, we're going to keep having these conversations. And again, it's not going to be tiresome. It's not going to be ad nauseum. We are going to continue to have it until it gets to the point where something has to be done. And there's not going to be any, especially from this standpoint, we're not going to have any level of fatigue. Like, oh man, I just talked about this mass shooting and that mass shooting and that mass shooting. Like, maybe they're tired of hearing from it. Like that's not going to happen. I, as a healthcare professional, as a physician, one who, since I was in elementary school, said I want to take care of people. And when I decided to jump online, because I felt like, yes, I can take care of the people in my local community, maybe the people in my office face to face, but like, I have such a message that I know I need to continue to spread this word out. I knew that times like this was extremely important to continue to have to spread that word out, right? So again, when we talk about gun violence, when we talk about this aspect of a public health issue, like, I want us to know some things, right? Here in the United States, we own twice as many guns, like, per resident than the next neighboring country. Think about that, right? So we in the United States own twice as many guns as the next per resident as the next country. Here in the United States, gun violence has now replaced automobile accidents for the number one killer for children. Like, let's think about that. Your child is much more likely to die here in this country. And I want to say this country because, and I've said this before, we have especially here in the United States, we have this geographical block on us that makes us think that because we're here in the United States, the quote unquote land of the free, there's a lot of free countries here in the world, but land of the free, home of the brave, because we're here, that we are doing so much better than other countries across the world. And I'm sad to mistake it. Like, and I wish I had this clip. I'm not sure if I could even play it because of copyright issues. But there's this one show, I think it was called Newsroom off HBO, where he just listed the number of things that we are terrible at in this country: maternal health, fetal health, child health. Like, he just listed things after things. And again, like I said, I wish I could drop it, but like, I think I wanted to do it, but I think copyright issues won't let me to do it. But what I'll do is, like, after I'm done with this, I'll put the link in the description so you can watch it yourself. But he just listed the number of things that we are absolutely terrible at. But one thing I will tell you, one thing we're good at here in this country is killing our own citizens and our own citizens dying by guns. We're extremely proficient at doing that in this country. And when they talked about this, again, because we're not here to give mass murderers, any just due here, right? But when they talked about his rationale and his reasons, immediately, like, you saw people try to say, oh, mental health, like, it got to be mental health, right? Especially those who are pro guns and, want us to believe that, no, the guns have nothing to do with it, or the access to these guns have nothing to do with the fact that people keep getting mowed down at shopping centers, in parks, in schools. Like, no, that has nothing to do with it. It's the fact that the mental health. And we've already talked about this, like, the correlation between a mental health disorder and gun violence is extremely rare. Like, that's not a thing that goes together. 1 in 5 people in this country are dealing with a mental health issue. 1 in 5 people do not enact gun violence. 1 in 5 people are dealing with some type of mental health issue, but I can assure you, because the numbers clearly tell it, 1 in 5 people are not sitting here like committing gun violence, which again, should scream when you hear people immediately want to go to that. Like, oh, it must be that, right? Like we have to learn to pump our brakes. And again, this occurred at Highland Park, right? And immediately I saw people initially say like, oh, Chicago. Like, guys, this is approximately 40 plus miles away from the city of Chicago. No, this is not a Chicago thing, right? This is a United States thing. Like, gun violence, mass shootings is a United States thing. In fact, if not for the fact that the gun violence continues to rise, like, I would just call this an endemic, right? Gun violence is just endemic to the United States, right? And for those who may not know what an endemic is a disease process that typically occurs at a constant rate in a specific region. And for example, when we talked about monkeypox before, the reason why monkeypox is getting a lot of fanfare because monkeypox used to be endemic to certain area in South Africa. It used to be like in that area, South Africa, yeah, you're likely going to deal with monkeypox. Like, so it didn't even shock you if you dealt with monkeypox in that specific area. It becomes a problem when all of a sudden you're dealing with monkeypox in places where you shouldn't be dealing with it. And when we talk about gun violence here in this country, the reason why we can't even classify it as endemic to the United States because it keeps going up. Like, the rate continues to increase over and over and over again to the point where we're like, all right, like, until we get some type of stabilization as far as the number of mass shootings that occur here in this country, like, this is a pandemic that is continuing to grow, spread like wildfire. And again, it's like we have a fence around the country because it's not going to jump to Canada. It's not going to jump and go to Mexico. No, it's going to stay right here where it's loved and respected more than anything else. So let's give some public health facts just so we can kind of get on our P's and Q's as well as far as public health is concerned. And I actually got a few sites that I want to go to kind of have this discussion. Let's go to this one first. So again, this is a graphic here that I want to again release June 9. Gun violence is a major. In fact, let me make sure y'all can see that. Perfect. Gun violence is a public health problem. It's a major public health concern. Gun violence is a leading cause of premature death here in the United States. Guns have become the leading cause of death for children in America, surpassing motor vehicle accidents. Again, remember, like, if you're a child, you're more likely to die from a gun here in this country than the motor vehicle accidents. Americans kill each other with firearms 25 times as often as other high-income countries. In 2022, there have been 248 mass shootings within the first 159 days. Guys, let's just pause there for a second. Let's just think about that for a second. 159 days, and again, this is not even. I'm not sure how updated it is because I'm not sure if today's day 160 yet. And this is June. Sorry, so it's not updated up, and this doesn't even include what just occurred. 248 mass shootings in 159 days, guys. Like, imagine these facts and figures. Imagine you being a part of the country where that is true, and then assuming that you have some superiority over the other countries just because you think your country is free. And again, just kind of mention recent mass shootings continue to devastate communities nationwide, and a call to attention to public health needs surrounding gun violence, right? And then for those who may not know, because you're going to hear this term, and I was actually talking to a good friend of mine, Michael Swin is a lawyer, right, who talked about the fact that even the way we define mass shootings has become of concern because it's not universal. It's not a universal definition for mass shootings, but here they define it as an event in which 4 or more people are shot or killed. And again, we kind of mentioned how it's overtaken auto accidents as the leading cause. Now, of course, these are some issues and concerns. Mental health impacts, like school shootings, right? Profoundly change hundreds of thousands of children's lives with no physical injuries, right? So again, let's think about this. You could be like, if let's say you went to that school in Uvalde, if you were a student there, but you didn't happen to die there, imagine thinking about that every time you had to go to school. And you're shutting down the school because of it, right? Imagine, yes, you did not physically die, right? So for the people who are like COVID deniers who are like, well, only 1% die, right? And they only focus on that 1%, but they never focus on the families and everyone else like associated with that people who happen to die. Like, imagine the mental health deficit that you're going to have to endure. Like, if you still had to go to school there, if you still drove by the school, like, imagine that, like, growing up, and then you are having to process all of these things and continue to grow up. Like, oh, hey, school's like summertime, because remember, it was the last day of school, summer or last week of school, summertime, enjoy your summer, get back ready for school. Like that's a problem that these kids and people have to deal with for the rest of their lives. So again, not only does gun violence affect the people who, and that's why when people ask, like, because you'll see this question a lot, is gun violence a public health issue? Yes. And the reason why is because not only does it affect the people who it directly affects, but the indirect effects of gun violence continues to spread and live with us, forever. All right. So let's go back to our slide. Perfect. The stigma, again, mental health experts say it's inaccurate to blame mental health issues as primarily responsible for gun violence in the U.S. More than 1 in 5 people in the U.S. experience mental health illness, and it is rare for a mass shooter to have a diagnosed mental health condition, right? And what you see a lot, especially from these gun lobbyists, is that after the fact, like the person that will have no history whatsoever of mental health illness, but after a fact, they want to tag a mental health illness on them because that's what they want to do to excuse the fact that they're using assault rifles that are so readily inherent in this country. Again, doctors, here I am. Physicians are speaking out against gun violence. Again, I'm a part of a couple of medical organizations that I'm extremely proud that, when things like this happen, they continue to reiterate the fact that they are 1,000% against gun violence and 1,000% in support of, common sense gun laws to try to curtail like the mass epidemic of violence that's occurring in this country. And again, mass shootings comprise only 2% of the public health problem. So gun violence is a routine and long-term issue across the country. And of course, me, when especially when it affects me, communities of color are disproportionately impacted. And gun violence is a leading cause of death for Black males under the age of 55, y'all. So again, just something that, again, continues to hit home for me when I'm speaking about gun violence, when I'm speaking about this public health issue. Again, if you don't know, not only am I an osteopathic physician, but I also have a master's in public health. So I never look at a disease process or something that's going on in my community as just what's happening to this individual. I'm always looking at it in the lens of my public health goggles. Like, wow, like if this person is affected, like I wonder what the community that person come from, how like they're dealing with the same issues, same stress levels, so same stress levels of concern. Just to share another page as well. Give me a second. Because again, it's sad the state that we're in now. This was a good one. So again, gun violence, the escalating public health crisis, and this is where I kind of mentioned the fact that we can't even say that this is an endemic because it continues to grow so much that it becomes like we're still having to deal with it. And then you can just kind of see from the date. Horrific mass shootings this week at the Robb Elementary School in Uvalde, right after the Buffalo incident that occurred. And again, it was the 27th shooting with injuries or deaths, school shooting with deaths this year. Gun violence has been on the rise for numerous years, has increased more significantly since the pandemic began. So this is another pandemic focus, right? Like again, a lot of the news and fanfare around the pandemic is kind of focused on this aspect of COVID-19, but there's a lot of issues that have been stemming from the fact that this pandemic has like really affected us, especially here in this country. More than 45,000 Americans dying by a gun in the year 2020, which is a 15% increase over 2019 and a 40% increase from 2010. Almost half of the deaths, nearly 20,000 people, were homicides. right? Gun Violence Archive recorded more than 60% more deaths by gun. And again, they excluded suicides in 2021 than in 2014 when they first started keeping numbers. And of course, because people always want to know compared to other countries, I kind of mentioned this, the U.S. civilians own double the number of firearms per resident. So we have all the guns, but yet for some reason we keep killing each other, right? Think about that. We have all of the guns, yet we keep on killing each other. The vast majority of homicides in the U.S. carried about 80% carried out by a gun compared to 37% in Canada, 13% in Australia, 4% in the United Kingdom. Right, guys, this is a United States problem, and we have to start owning to the fact that this is a United States problem. And this is why it matters, again, from a public health perspective. People who survive gun violence, approximately 85,000 Americans each year, again, 4% in the United States, face ongoing trauma and long-term health conditions, including high rates of PTSD, chronic pain, and poor mental health. Guys, if you're worried about poor mental health, think about the mental health of that 2-year-old child, right, who's going to continue asking, when is mommy and daddy coming home? Gun violence is preventable, and other countries have achieved significant reduction or elimination of mass shootings with the passage of gun reform, y'all. The American Academy of Pediatrics and American Public Health Association recommend the following actions. Again, we don't need to go into the, in fact, let's go into the details. Common sense gun policies, prevention and research, violence prevention programs, right? I'll have this description I'll have this website in the show notes for those who may want to follow along. But again, that's just to continue to highlight this growing problem that is a growing United States problem. We have to think about gun violence as a United States problem. It is not a worldwide issue. It is not a let's focus on some random city in the United States. No, this is a United States issue. Now, we have seen plenty of mass shootings and gun violence specifically related to racist tropes out there. Of course, when they went to look to see, hey, what has this guy been talking about? I now know that this guy was some rapper, which again is absolutely ridiculous. I know he was posting things on his social media platforms. I know that he was a very avid supporter of Mr. Trump, the former president, right? Which again, when you allow a hotbed of anger fester in a community and say, hey, you know what? It looks like you're angry, and I'm okay that you're angry for reasons that you shouldn't be angry for. Hey, come, and you welcome people like that. These types of things continue to occur, and until we here in this country really, really take a good look at ourselves and really acknowledge, we have to take this on the chin. We're not going to get any better. Again, as I'm a United States citizen. So as a United States citizen, I'm not going to sit on my porch and act like, oh, no. They have the problem, right? But not me. I'm okay. Our community is good. No. As a United States citizen, I have to take it on the chin as well, that I am a part of a country that has allowed gun violence to continue to run rampant to the point where it only runs rampant here in my country, right? I am a part of it. And as a physician, the question becomes, what can I do? We've talked about different ways that physicians can help, but more importantly, because especially I'm seeing these interviews with the parents, and all of a sudden the parents are standoffish. I don't know what happened. I wasn't paying attention. This is when you have healthcare providers really having to be in the ears of the families, especially when they're seeing them in their outpatient clinics or seeing them in the urgent care. These are questions we have to now start thinking about questions. Just like when we say hey, are you taking your medications? Any problems? We have to start asking for questions hey, do you happen to own a gun at home? Right? Do your kids have access to guns? Is everything okay? Is there any issues, concern? We really have to start asking these questions, but clearly the parents aren't asking them. The mom and dad are sitting at home, and he's doing these things right under their nose. He's posting these things right under their nose, and now they're completely oblivious to what's going on. So now 7 people who were just going to celebrate, the United States independence, which is a whole different discussion. They just went to go celebrate the United States independence on July 4th. They thought they were going to have a good time in Highland Park, and now they're dead. Grandpa's dead. Husband, wife, dead. Former school teachers dead. Right? I think one of them was like a financial administrator, like dead. Like this is not normal. And what's sad and what's scary is that this does not even rank in the top 10 of mass shootings here in this country. Like, think about that. Like, I just said 7 people died at Highland Park, Illinois, and it does not even cause a blip here in this country as far as gun violence is concerned. Like, if that's like what do you do with that, y'all? Like, what do you do when you know like that's what you're having to go up against, right? You're having to go up against to the point where like you have to shoot in the multiples, right? Double-digit numbers just to register in the top 10 in this country. Because if you don't hit double digits in the top 10 of this country, you don't even, if you don't hit double-digit mass shooting killings, you're not even in the top 10. Like, which that's scary for so many different reasons. And if it doesn't scare you as a physician, if it does not scare you as a public health professional, right? Like we are going to continue to see these things continue to grow. Like there's nothing, right? There's no evidence that we have at this moment to say that this is going to slow down on its own. It's not. Just like when we had COVID and we said, hey, if we want this to slow down, we got to wear a mask. We have to social distance. We have to get vaccinated. If we want gun violence to slow down, we have to do something. We cannot pray. We cannot give well wishes and close our eyes and then hope that it just gets better. It's not going to occur. Because if we rewind it back, if we just did a quick rewind to March 2020, and when COVID was just ravaging the numbers across this country, if we just say, hey guys, don't worry about it, it'll be okay, just pray on it, we'll give your well wishes to your families. Like if we did that, we would still have people. Actually, we still have people dying in the thousands per day due to COVID. But no, we said, you know what? Something needs to happen. I'm going to be proactive in my intervention in doing so because I want a change and a result to occur. So when we have this conversation on gun violence, and like I said, I, as a physician, as a public health professional, will continue to have this conversation on gun violence here in this country because, again, it's a United States problem. As we continue to have this problem, we are going to have to meet it head on and do something about it, right? Because if not, I'll be back here to do another video, which unfortunately, because of the way this country works, like give it a month and I could likely be talking about another mass shooting, right? And that's like, if that doesn't sadden you, if that doesn't depress you, and even if you're not directly, like I said, I don't know any families personally that were affected by this most recent shooting. I don't know any families personally that I know of, but it doesn't mean I'm not going to be empathetic to the fact that, like, I know that there's a lot of lives that were changed on July 4th because they just happened to go to a park. Yeah. Just sad and scary. Again, I'm yours truly, Dr. Pierre. Again, thank you for sticking with us. Shout out to my replay viewers. Thank you for sticking with us on another episode of The Real Physician Reacts. And I'm going to see you guys